Wonderful. Hello, and thank you for joining us for today's session. This webinar is part of our Capital Conversation series, where we provide a unique opportunity to hear directly from key policymakers, leading experts like we have on the Zoom screen today, and the Lutheran Services in America staff about the latest policy developments and their implications. Today, we'll be learning from experts about the impact on housing services and providers of the increase in the low-income tax credits in H.R. 1, as well as how we can best engage the state Medicaid offices as they implement the healthcare provisions of the law. So joining us today for this discussion are Althea Arnold, and she's over there, Senior Vice President and Chief Operating Officer of Stewards of Affordable Housing for the Future, otherwise known as SAFE, and Cory Caldwell, who serves as Senior Policy Analyst, the National Association of Medicaid Directors, NAMD. So now I'll turn it over to Bill Callistad to provide a framework for our discussion today.
Thank you, Alicia, and thank you all for joining us for today's session. We want to be an interactive session, so please enter your questions into the chat box at any point. Before we formally begin, we'd like to ask you to complete a question poll here to get your knowledge on where you are in regards to the conversation today. All right, I'm going to share the results. Great, thank you. Sounds like we have right between a basic understanding and a good understanding there, but we have some people also who can gain through some of the knowledge that we're going to share today. So I'm going to share my slides, and I'm going to provide a quick update on some policy things that are currently happening. Okay, just one second here. So currently, as a government, where they stand right now in regards to the government shutdown, as many of you may know, the House recently passed a continuing resolution, mostly along party lines, to fund the government through November 21st. So that was from the House side. From the Senate side, they have not acted due to stalled negotiations with the White House, making government shutdown likely. And this probably will occur October 1st. While Republicans generally support a clean short-term funding patch to allow time for negotiations, Democrats are insisting on a temporary bill, which would include permanent extensions of the expiring insurance premium tax cuts. At this time, it is forcing a shutdown of sorts. Currently, our president has canceled a planned meeting with Democrat leaders that were scheduled for today and has now been signaled he would use a shutdown to shrink federal agencies designated for fewer workers that are essential. And according to the administration, also directed agencies to considering firing employees working on unfunded programs that don't align with the priorities and the plans for additional downsizing once those funding resumes. I would encourage people to look at our LSA Together that's going to be coming out soon about ongoing advocacy issues and updates for the further situation. The other thing that I wanted to just share would be another thing that's been released is CMS has opened applications for a $50 billion rural health care fund for H.R. 1. Those applications are due on November 5th, and they're really for funding specific rural health challenges and possible solutions for the Rural Health Transformation Program. That funding could begin as soon as October 1st, with $10 billion being available for distribution over the next 5 years. I've asked Kylie to put some of the links that I talked about here briefly in the chat. So if you have any questions about those, you would be able to access that there. All right. I'm going to transition us to our next speaker, and thank you for your time. Thank you, Althea.
Okay, thanks, Bill.
And
Just need to get permission to share my slides now. Okay. Well, hi, everyone. I am Althea Arnold. I'm Senior Vice President for Policy and Chief Operating Officer at SAFE, or Stewards of Affordable Housing for the Future. Actually, you'll see one of my colleagues is also a participant on this webinar. She's our Director of Health and Housing Partnerships, so I thought it was really great if she could participate in this as well. But let me just tell you a little bit about SAFE, and then I can talk to you about what we're watching in terms of HR1. So if you don't know us, SAFE is a collaborative of mission-driven nonprofit housing providers, all working across multiple states, and that they're all committed to ensuring that every person has access to a healthy, sustainable, and affordable rental home in a flourishing community. So I head up our federal policy efforts at SAFE. I mentioned we also have a Director of Health and Housing. We also work on the built environment. So really trying to connect people to the communities that they do need to thrive. Our members here, 13 members, work across 49 states, over 150 rental homes, and really in every single kind of community that you can imagine. This is really just another way to look at this and our members' scope. So today, I just wanted to talk a little bit about affordable housing priorities. Bill mentioned the potential government shutdown, but I thought what I could do for you all today is really to dig into this HR1, One Big Beautiful Bill Act, OBA, or I also have it, I heard it recently called OB3. And so for the Star Wars nerd in me, I kind of like OB3. And so how OB3 is going to really shape the landscape for the low-income housing tax credit and other housing priorities that we're watching. So I'm sure you all know this, so I can run through this really quickly, but I did want to highlight some of the big picture items from OB3. And really, it's very expansive. It was over 900 pages long. And it was passed under budget reconciliation. So what that means is it had to have direct impacts on tax spending and debt-related provisions. A lot of the details of various legislation are not included in this bill because they don't have a impact on the spending aspect. So that's where you're going to hear a lot about, well, what does the implementation look like? Very little is made clear in actual legislation. It is going to end up the federal government, the state governments, looking at what implementation looks like. The other things that I just wanted to mention is that, big picture, this is going to increase the debt ceiling by $5 trillion. It's also expected to increase the deficit by $3.4 trillion. I'm sure Cory's going to talk more about this, but there are changes to Medicare. There are changes to social safety net programs like SNAP benefits. There are changes to clean energy programs through the Inflation Reduction Act. And there's also more funding for immigration enforcement spending. So really, it's a sweeping fiscal and policy package. But for us at SAFE, what we have been tracking most is what's happening on the affordable housing side. So let me dig into that. Okay, so focusing on affordable housing, the big headline here, something that affordable housing advocates have been pushing for a very long time, We're excited to see that OB3 has two provisions to expand the low-income housing tax credit. First, and this is the one that really impacts the 4% low-income housing tax credit, or you may have heard about it as like the as of right tax credit. This 4%. So what the change is that the bill lowers the private activity bond threshold from 50% to 25%. And I'm sure that doesn't make a lot of sense to many of you, because what does a bond test have to do with affordable housing? Well, the 4%, when I say that it's as of right, really what I'm saying is that to qualify for a 4% low-income housing tax credit, you have to have a certain level of your deal funded through private activity bonds. Previously, it was 50%. This bill now brings it down to 25%. Opening up potential opportunities for the 4% low-income housing tax credit to be utilized. The bill also makes a change to the 9% housing credit, and that is to increase the overall allocations every year by 12%. You may remember that a couple of years ago, there was Senator Cantwell push for a provision to increase the housing credit by 12.5%. And that was in place for about 4 years. Many housing groups benefited from that, renters benefited from that increase. That expired just a few years ago. So this is an attempt to reinstitute that for various reasons, mostly due to costs. They lowered it from 12.5% to 12%. But really important for both of these provisions, they're permanent. We're not expecting these to change in 4 years. These are permanent changes that investors, lenders, housing providers, renters can all rely on now. A few other tax provisions that I wanted to highlight. There's now a permanent 100% bonus depreciation, which could also help with the low-income housing tax credit investors and boost pricing in that. There's also a permanent extension of the Opportunity Zone tax incentive. Many of you have probably heard about this. Limited use in affordable housing, multifamily housing developments thus far, but there's potential, obviously. And then it also permanently extends the New Markets Tax Credit Program and locks in $5 billion for it annually. So that has been something that many affordable housing and community and development folks have been pushing for years. So some really great provisions on the direct affordable housing side of this equation. Now, let me get in a little bit more into details and what this really means for implementation. So that 4% lowering the bond test, we're anticipating that this could potentially mean 1.14 million additional affordable rental homes over the next 10 years. That is great. This map here shows you where states, every state has a cap for their private activity bonds, so they can't go over that cap. The states that are in the darker color here are all oversubscribed, meaning they've reached their cap, they can't do any more, for example, 4% deals in the current scenario. Those in the yellow are at parity. They're right around that cap. And then the ones in gray are undersubscribed. So really what you're looking at when you're reducing that bond cap from 50 to 25% is you're opening up more opportunities, but really it's going to show up more in those states where there is a darker color, where you're seeing that darker orange there. Because those are states where they've already been oversubscribed, so opening up more opportunities on the bond side will open up more on the 4%. Now, there's another really important component to how this plays out in reality, and that is the assumptions being made here assume that there's scalable gap financing for these 4% deals. And what we know about, federal appropriations and where things are, that may not happen, right? We're seeing more challenges to programs like HOME, to Section 8 and others. But really, to reach the full potential for these changes in the 4% and bond tests, we need to ensure that there's more soft funding, because once again, if you're looking at a deal and going from 50% of that deal had bonds to now 25%, now you have 75% of that deal needing those soft funding resources. So I bring that up as thinking about, like, what are the resources in your states, in your localities that you can bring to bear on these 4% deals. This is just where states are in terms of implementing strategies on that 4% and the bond test threshold. Some are making headway. Some are really considering, like, what does that mean on the soft funding side? What does it mean when we can't guarantee that the rest of that bond cap is going to be used for multifamily housing? So there are areas for opportunity here on advocacy and prioritizing certain kinds of transactions. I think there's a real opportunity here for preservation transactions. And so, just wanted to flag that as these are now very much in flux and changing and updating. On that 12% increase in the 9% credit, I'm not sure how much you'll be able to see this exact slide here, but what you really want to see is that very top gray dotted line. That is where we are hoping for an expansion of the low-income housing tax credit through the Affordable Housing Credit Improvement Act. So this is sort of what we're still pushing for, recognizing that there's an intense need out there. What you see down below is really where that change with this OB3 has made. So there's quite the delta in between the two, meaning that, it's not that huge expansion, but it's something, and we have to recognize it as something. On clean energy, I'll walk through this really quickly, but I do want to flag that several clean energy tax credits were either cut back or their wind down has been sped up. So while they are originally supposed to go until, say, 2032, they're now, only eligible for some projects until, say, 2027. So what does that mean for affordable housing? In many cases, these were going to be considered for some preservation transactions, or, unlocking other funding sources. So in terms of the tight time frame, it's really important for builders and developers hoping to utilize those credits, especially the 45L solar tax credit, to get going before June 2026. So you have about 6 months. It is a very tight time frame to really get that going. And then it's going to impact potential planning and construction timelines. If those tax credits have been relied on for some of this, for part of your stack, your capital stack, you're going to have to look elsewhere. So these are just a few of the implications that I wanted to mention to you all. And then I'm sure Cory's going to get into this more, so I won't get into the weeds of the changes that occurred in OB3 with Medicaid and social safety net provisions. But really, in terms of how we're thinking about that in health and housing partnerships, the fewer Medicaid customers that we're anticipating like a loss of potential interest in insurers, payers participating in some of these healthcare housing partnerships. It's not a done deal. They may just want to be more targeted in their approach, but it is certainly something that we're watching. And then one of the things that we've been also watching is what these impacts mean for residents of affordable housing. So, you know, one of the most recent analyses of OB3 said that people in the lowest 10% of the income distribution in the US, which just as a heads up, that's pretty much the safe member portfolio. That is folks relying on federal rental assistance. So these people stand to lose non-cash government benefits such as Medicaid and food stamps worth nearly $1,600 per year. So that is a really significant impact on them and on low-income individuals. We do think that that has a potential to not only impact what the residents can afford, but their ability to pay rent, to pay other basic needs. So that's just one other thing that we want to be monitoring and acknowledging in this OB3. So really, the big picture here for housing, it's a mixed bag. We were excited to see these provisions on the low-income housing tax credit and permanent extensions of many programs that folks rely on. However, you know, the impact on residents, on different partnerships, certainly has an impact on affordable housing, generally speaking. So I will just conclude there and look forward to the continued conversation.
Thank you, Althea. That was great. Really appreciate your time coming to join us for conversation about that. And it's great to share some good news of some legislation and some permanency there around housing. Housing is top of mind for many people we support and their families. So appreciate that. We can guide through. We have a few minutes here for questions, and just wanted to see if anybody had any questions. You can raise your hand and we can call on you and bring you forward, or you can put it in the chat and I can facilitate the question. It's always a good sign when someone's already asking for your slides in the middle of the presentation. So thank you.
I think everyone's just eager to hear from Cory.
Well, and so this is Sarah, and one thing I would ask, and I know you touched on this kind of broadly, but just as you're looking forward now to the I'm still going to say potential, but the very likely government shutdown and the very likely intense government shutdown, what kinds of things are you watching, or what kinds of things would you suggest for kind of given our network member portfolio that they might be most interested in tracking and paying attention to?
So I don't want to be alarmist. I'm generally not an alarmist person. And we've experienced government shutdowns before for various lengths. The piece that does concern me is some of the news coming out today of impacts to federal staff, you know, potentially cutting federal staff during a shutdown. I think that this administration has made some very concerning decisions as to what to do with federal programs, on rescissions, on saving these programs that many of us rely on. So I think that's something I'm certainly watching. I also would say that, you know, one of the things that SAFE members and others really focus on is looking at the contingency plans that come out of federal agencies. And so HUD usually has on their website their shutdown plan. I mean, contingency plan is their shutdown plan. who is going to be the skeletal staff that remains, who's considered essential, what kind of transactions are going to be allowed to go forward during a shutdown, who do you contact, what gets held up, all of those details. HUD took that down, and they have not put out their new shutdown plan. I find that concerning. I am eagerly watching to see what they're going to do with this and what is prioritized. Our members rely on timely Section 8 payments. In previous shutdowns, that continues. That is considered an essential task. I do believe that that will be the case, but you know, it's certainly concerning that we don't have a contingency plan to really explain that and to give us much confidence in that right now.
Thank you.
Thank you, Althea. That's a great way of saying that. I think that historically, when there's been shutdowns, there's kind of been an understanding of what that might look like. And I think that right now we know that history is not always how the playbook will go going forward. So I think it's good to be aware of that and have concern. We had another question where it said, what recommendations might you have for our members to leverage LIHTC? Any specific suggestions who they should be talking to or working with?
Yeah, I would certainly urge you to work with your state housing finance agencies, or they're often called HFAs. Most of them are the LIHTC allocating agencies. So that is one choice. Local developers, nonprofit developers who are trying to do these deals certainly need good partners. And so thinking about how to, and also how to prioritize certain deals that I mentioned, like preservation. Preservation is key. We are not preserving the number of affordable homes that we need. And I saw that Meg had a question about the number. The number is far greater, Meg, than any of this gets to. We need far more affordable rental homes, but we're also losing 2 rental homes for every 1 we create. So we're losing traction here. And so I would urge you to think about opportunities for preservation, not just new construction. And I think that the changes with that bond test and the 4% is a really great opportunity. Preservation usually takes less money. You're going to have less need for those gap resources than in a new construction deal. So there are opportunities to try and push your HFAs, push your partners to consider those kinds of transactions.
Well, thank you so much, Althea. We are going to transition to our next conversation. So we do want to thank you for your time and your expertise, and appreciate your time on sharing this information with our national network. Cory, we're going to turn to you here. We'll get you a chance to set up your slide. We really appreciate you joining us today and sharing us more about working with our state Medicaid offices as we implement HR 1.
Well, thank you so much, Bill. And I am going to share my screen here. I told the team when I hopped on just before starting that I have multiple monitors, so I apologize if you never know what you're going to see. You should be seeing my larger PowerPoint slide here. But
Looks good on our end. Thank you.
Oh, good. Perfect. Yeah, I never know. Sometimes you see my email, so don't want to look at that. So good afternoon, everyone. My name is Cory Caldwell, and I am a senior policy analyst with the National Association of Medicaid Directors. And today I'm going to very quickly kind of walk through some key considerations for partnering with state Medicaid agencies, especially as they're going through this time of implementing HR 1, the One Big Beautiful Bill Act, or OB cubed, however you choose to call it. Before I jump into the content that I have for all of you today, I really want to do a quick introduction of NAMD. NAMD, or the National Association of Medicaid Directors, is the national trade association representing all 56 state and territorial Medicaid directors, as well as more than over 400 members of their senior leadership teams. And our mission is really focused on elevating state expertise, providing thought leadership, and supporting states in driving continuous improvement within their Medicaid programs. Today, I'm going to very, very quickly run through a few kind of key areas to be aware of as you are approaching a Medicaid agency wanting to partner with them, especially in the context of HR1 implementation. And one, I'm just going to kind of set the broader policy and budget context through which Medicaid agencies and states as a whole are operating right now. I'm going to walk through some of the key changes under the One Big Beautiful Bill Act, although I will add one caveat. I'm not going to go into a whole lot of detail in terms of specific provisions because it is a very, very large tax bill. I'm also going to talk through kind of what implementation will mean for states and their partners, and then I'll kind of close out with just some details in terms of advice for partnering with state Medicaid agencies during this time of implementation. Now, to really understand how to approach a Medicaid agency in relation to like a partnership proposal, it really is important to first understand the environment and they're operating in and really the challenges that they've been managing in recent years. It certainly has been a very intense few years for the larger healthcare system, but for Medicaid as well. And if you look at the far left here of my screen here with the COVID-19 public health emergency, I'm sure many of you are aware, Medicaid agencies saw huge kind of rapid enrollment growth and were able to utilize emergency authorities in order to maintain continuous coverage for members. They had to do a very kind of rapid uptake of telehealth expansion or telehealth utilization and building out in their states. And they had to really kind of stabilize provider networks in a very kind of unstable time in our healthcare system. I also want to highlight as well, there was a very significant influx of federal funding that helped ease budget pressures for states. And it really gave states the ability to kind of respond quickly to the evolving healthcare needs of their members without having to necessarily worry about some of those budgetary components to kind of investing in those services for members. Also, once the PHE ended, you'll probably recall we went through an unwinding period where Medicaid agencies had to kind of redetermine eligibility for millions of members on their rosters. They had to adjust managed care rates, and they had to really spend down a lot of those federal pandemic funds, all while kind of doing their day job as well as kind of preventing disruptions to coverage and payments and kind of running their organization or their agencies. Since then, the Medicaid agencies have also had to adapt to a new federal administration that has new priorities. States have very significant tighter budgets now than they did during the pandemic, and kind of we're taking part in some of those ongoing congressional negotiations that kind of led to the budget reconciliation process or the production of HR1 or the One Big Beautiful Bill Act. We're kind of sitting at a place right now where agencies are preparing for the implementation of the One Big Beautiful Bill Act, which in and of itself will bring its own set of administrative and financial challenges. And I do want to highlight that while the impacts will vary by state in terms of HR1 implementation, specifically to the Medicaid programs, all agencies are going to face kind of one core reality, with that being kind of balancing new federal mandates with constrained budgets while sustaining kind of the critical services for their members. One of the biggest challenges I think I need to highlight as well here in terms of what you need to be aware of if you are going to approach a Medicaid agency in terms of partnership is that Medicaid agencies and just states across the board are going to be facing very significant budget pressures as we head into this next year. And the reason for that is that states across the board in Medicaid programs are really dealing with slowing revenue growth and the end of those pandemic era funding sources that I kind of talked about earlier. And with that reduction in state revenue, they're losing some of the flexibility that they had in terms of investing in some of the Medicaid initiatives that they've been working within throughout the past few years, specifically like during the COVID-19 pandemic. I also want to highlight that Medicaid now represents nearly 30% of total state spending, and that makes it the single largest line item in the state budget within most states. And what that means is that even small changes in Medicaid costs can really ripple through state budgets and impact other priorities like education, infrastructure, and social services. I also want to quickly highlight here on this slide as well that healthcare costs just kind of across the board are rising faster than the overall economy. And while Medicare and commercial insurance expenses are rising faster than Medicaid, Medicaid spending still kind of remains significant, especially given the fact that any amount of increased costs in the Medicaid program really makes it difficult for agencies to kind of squeeze the most amount of resources they can out of every dollar that they have. And just some examples here in terms of why healthcare spending is going up in Medicaid can include factors like federal policy changes, prescription drug costs, long-term care-related costs, healthcare labor costs, and program administration. And you're probably wondering, like, why are you telling me this? But this is just something to be aware. If you were to approach a Medicaid agency, this is the context which they're coming to the conversation with you. They are dealing with some very, very tough budget situations in the current fiscal environment. This slide here is a supplemental slide to my previous text on the budget situation, and it really just kind of breaks down state expenditures and showing kind of within a state budget. And in the far left here with my donut graph, you can see that 29.8% of the state budget is comprised of expenses related to Medicaid. If you round up, that's about 30. And then here on the far right, you can see Medicaid expenditures by source, this is just Medicaid across the board, across all states, showcasing kind of where the money is coming from to pay for the state expenses. So this light blue, sky blue box is the federal government share of what they pay for in terms of total state expenses. This dark blue box down here, these are the general funds that are coming from state legislators. And then this olive green box up here at the very top are state contributions through other kind of funding mechanisms. Now, as what was shared in the previous presentation, but HR 1, or the One Big Beautiful Bill Act, of course, became public law back on 4th of July of this year. And in terms of Medicaid, it's really going to reshape many aspects of the Medicaid program throughout the next decade. And with this slide here, you can see specific to Medicaid, the bill is going to really address three main categories or domains of the larger Medicaid program, or really impact these three domains in the Medicaid program, that being eligibility, financing, and program integrity. And before I go into detail regarding some specifics about these three domains, I do have to highlight, and I want to note that all Medicaid leaders, all Medicaid directors across the country really do share one common goal of implementing HR 1, this law, and these changes as efficiently and effectively as possible. So that's just something I want to highlight as well here on this slide. But in relation to the eligibility changes, HR 1 really establishes additional requirements for Medicaid eligibility, particularly for childless adults who are covered through the ACA expansion. And some of the more frequently, I think, some of the more well-known provisions of HR 1 that have been picked up, of course, are the working community engagement requirements, eligibility redeterminations now every 6 months instead of annually, revised non-citizen eligibility rules, shortened retroactive coverage periods, and of course, a new pathway for home and community-based services, or HCBS waivers. In relation to the financing side, HR 1 really aims to contain the growth of the federal Medicaid spending, or the federal government's spending in the Medicaid program through changing the way in which states finance their own share of the program cost. Kind of like what I was hinting at with my graph on the previous slide, Medicaid is a partnership between the state government and the federal government, and each entity, whether the state, territory, or the federal government, has a percentage of what they pay in terms of the total state expenditures or total state costs of running the program. And so this HR 1 really aims to reduce the amount of money that the federal government is spending in the Medicaid program. And they did that by kind of changing the way states kind of finance some of their programs, such as kind of a prohibition on new or increased provider taxes, limiting state-directed payments to specific rates tied to Medicare rates, and just some requirements specifically related to like 1115 waivers and requiring budget neutrality as well. Finally, in relation to the program integrity domain here that you see on the slide, the HR 1 really was focused on creating new requirements aimed at kind of tightening program integrity and addressing audit findings, specifically kind of looking at ways in which to prevent individuals from enrolling in Medicaid in more than one state, requiring quarterly background checks for the federal death master file of states, and then also limiting HHS's ability to waive payment reductions when a state error rate exceeds 3%. Kind of like what I was hinting at on my previous slide, while all states are going to feel the impact of OPA implementation, the scale and scope is going to vary, especially based upon whether the state expanded Medicaid under the Affordable Care Act. certain implementation requirements, kind of like the working community engagement requirements, the redeterminations every 6 months as opposed to annually. They're really going to pertain to expansion states differently than non-expansion states. And on this slide here, I've listed out some additional examples as well, but I'm not going to read through them for just the sake of time. But that's just something to be aware of if you are approaching a state and wanting to partner with them, knowing kind of where your state sits in terms of expansion and how HR1 components may impact how your state will roll out the implementation of the law. This is something too that I think is very important, especially if you're going to your state Medicaid agencies now wanting to partner. States are very deep in the fiscal year 2027 budget development process now, and Medicaid agencies are already preparing their budget requests for this fall, essentially to be able to be reviewed and voted on by state legislators during winter and spring sessions. This isn't out of the ordinary. States Medicaid agencies have to do this every year to forecast kind of the funding needs they need to run their program. But this year is particularly different because states are having to forecast the cost of implementing some of the OBA provisions within HR1. I'm particularly looking at provisions that are going to take effect in calendar year 2026, like the working community engagement requirements and those 6-month eligibility redeterminations. I want to note as well that budget development for state Medicaid agencies is always complex, trying to project how much funding you're going to need for the year. But this year is uniquely challenging due to just some of the unanswered policy implementation questions that are left that we need from CMS in relation to some of the HR1 implementation requirements. And also, we're entering some new territory in relation to IT system changes and not really understanding kind of what those costs are going to look like as states are going to have to implement some of these new changes. In the far right side of my screen, I've listed some of the budget considerations that Medicaid directors are kind of wrestling with right now as they are thinking through the larger budget development for their program, but then also OBA implementation. One, of course, is caseload impacts, looking at how is eligibility and eligibility and kind of work requirements going to affect the number of people covered. What's going to be, if people do fall off of the Medicaid rosters, what's going to be the health needs or the acuity of those who remained? Are the people who are left on the Medicaid rosters going to be sicker and need higher levels of care, more expensive levels of care? Kind of like what I was hinting at with the technology investments, what will it cost to modify existing IT systems or what's it going to cost to procure new platforms to support like these reporting mechanisms with work and community engagement requirements? And then also looking at like workforce capacity. So a lot of these implementation requirements are new to the Medicaid agency. So they're going to have to hire new staff and they're going to have to hire a whole new set of kind of workforce to help with the increase in workflows that they have. And then I'll kind of hint on this as well. Financing challenges as well. I kind of detailed that earlier, that HR1 kind of changes the way in which states can finance their share of the expenses associated with their Medicaid program. So really trying to understand how the changes to the provider taxes and the state revenue streams are going to affect available resources to really help run the Medicaid program while also kind of implementing HR1. Let's see, this slide here, I'm going to skip over this very, very quickly, but I do think it's important to highlight that state legislators are going to play a very key role in implementing HR1, especially in the Medicaid provisions of the law. And it's really going to provide Medicaid the budget authority to be able to implement a lot of the provisions of HR1, getting the money to actually procure some of these systems and make the changes. So of course, Medicaid agencies and state legislators are going to be working very, very closely together to get this law implemented. Timing of state legislative sessions is also very important to note as well. I'm sure many of you know legislators typically meet annually or biannually for very short windows of time, like 45 days. And with the timing of when some of these legislative sessions fall, states may need to call a special session to retrieve the funding needed to be able to implement HR1. So that's something just to be cognizant of. And then also, Medicaid agencies are going to have to work very closely with state legislators to ensure state law is updated to be in compliance or aligned with new federal requirements that were published or that are required as a result of HR1 becoming public law. And then finally, I think I'm over my time here, but here's some advice for partnering with Medicaid agencies, especially in this time of implementation. And one, just be cognizant of the environment and the fiscal environment and some of the details that I shared in relation to the history and what they're operating through. Also, just kind of recognize the differential impact and timing of OBA policies in your state. Not all states are going to be impacted at the same time in relation to certain provisions, as well as they're going to be impacted differently in terms of different provisions, whether or not they're an expansion state versus a non-expansion state. Be sensitive to your state's fiscal context. This is something I want to highlight as well. States have to balance their budget. And in leaner fiscal environments like where we are now, excuse me, Medicaid will 100% face fiscal pressures. And with that being said, the decisions that state Medicaid agencies are going to have to wrestle with, especially as state legislators come to them and say, you need to find savings in your program, are going to be very, very difficult. So that's something to just be cognizant of as state Medicaid agencies and legislators and states across the board are making these decisions in relation to budget spending and their Medicaid programs. Also, kind of just acknowledge the immediate operational realities for Medicaid. We are still awaiting regulatory guidance from CMS in relation to many provisions of HR1. We need CMS clarity in terms of some of those implementations, and also just be cognizant as well as some of those budget challenges that were shared, the IT system issues that states are going to have to work through in the role of your legislator, and then also partner in offering solutions and expertise, such as helping Medicaid kind of communicate policy changes to members, providers, and other stakeholders. I think this is a key role that stakeholders and partners can play in helping Medicaid agencies, is really getting the word out to members regarding some of the policy changes that will be coming. And I want to note as well that we're still very much in the implementation, planning and early stages of implementation in relation to some of the Medicaid specific HR1 provisions, but ensuring that you're offering your voice, being able to help share the word with Medicaid members and to ensure that they're aware of some of the changes that are going on. Because it's confusing for people who, like me, who are reading this policy all the time, but I can only imagine for folks who are not necessarily in the weeds and just trying to follow along. So that is all that I have. So thank you all very much for your time, and I will stop sharing and hand it back to you, Bill.
Thank you, Cory. Really appreciate your slide and the attention you put in the detail in the slides there. And I definitely know the challenge for our members are that a lot more onus is going to come to the state in regards to their dollar amount, but also to demonstrate our ability to provide essential services, but also creative and important services that are recognized by the state. So we appreciate that. I also want to thank your organization and your team to presenting this summer with our board of directors and keeping both our board of directors, but also our members aware of the changes that are happening and keeping us abreast of that. So I'm going to pause for some questions here. We are close to time here, but I'll pause and see if there's some initial questions. All right. Well,
Oh, that's just me, Bill. I was
Thank
just,
you.
No, we'll be sharing the
recording the
slides.
slides.
Yeah.
Yeah. Well, thank you, Cory. I do think we're wrapping our minds around the way that we can engage with our states to help them, both us understand the changes, how it's going to affect us individually in the state, but also how to advocate for the importance of our service so that they see those as important and essential to the budget. But also it's important to be aware of the challenges that each state's going to be affected with the changes. So thank you. All right, I'm going to transition to Linda. I'm so pleased that Linda's able to present with us and today from Mosaic, and Linda's going to talk a little bit about how they're looking at these changes and how they're starting to make adjustments to the new legislation.
Right. Thanks, Bill. And thanks, Cory and Althea. You set me up really well, I think, for some of the conversations that we're having and how rapidly things change, because I didn't understand the potential impacts of government shutdown until we heard some news this morning. right? And so trying to navigate that. So Mosaic serves about 5,000 people in 12 states. And we've been really trying to figure out how do you navigate this time of rapid change. So when I was asked to do this, I made a list of things and I broke them into categories. So here are my categories of what we've been doing. The first is, what do we actually know? And what don't we know? And then how do we educate people who make decisions? That's the first category. So I appreciate that with the state Medicaid directors, and I was momentarily feeling empathy for them and their difficult situation for sure. But the fact is that we know from history, and there's an article that we'll share in the chat for you that came from Health Affairs in April that talks about the history of when Medicaid cuts happen, how does that impact long-term services for people with disabilities and people who are aging? And so we're really relying on the past. So one of the things that is especially critical is educating decision makers at the state level about Medicaid programs and what happens. Because much of what we do, for sure almost all of what we do at Mosaic, is an optional program under the state Medicaid plan. And so in the past, our rates have been cut, people who need services haven't come on, payments are slowed, all those kinds of things. So how do we build their awareness of what we anticipate to happen? Because the fact is, the day after a Medicaid cut is made, we still have 5,000 people that need to be served, right? And so we're trying to figure this out. What we find time and time again is members of state legislatures and members of Congress do not understand Medicaid hardly at all. And so we have to make the program very real for them and tangible. So we've really been working on that. Cory alluded to this, that the state infrastructure itself is going to struggle to keep up with the demands of HR 1. And so making sure that we're lifting up those issues at the state level at the same time with Congress as they're trying to figure out how to implement the components of HR 1. So education, education, education. We're really deploying a different level of playbook at the state level to figure out who can our champions be to make Medicaid real for members of state legislatures, DD directors, and governors. That's a big part of it. The second piece that we've been focusing on is business planning. So some of that is just contingency budgeting, because I don't think we're going to feel the financial impact of HR 1 this year, but the next 2 to 3 years could be pivotal as all this comes to pass. Right? And so what cash do we have on hand? What are our relationships with our banks? We're really paying attention to revenue cycle. For example, we know that we had 160 people lose Medicaid eligibility last year. If people lose eligibility under HR 1 and it's taking 6 to 9 months to regain eligibility, can we afford to provide uncompensated care? Right? Those people still need services. That's a real issue. So we're just doing a lot of contingency planning. We've also just now, our benefit plan year runs on calendar year, and seeing up to 20% increases in our health insurance premiums. So how in the world do we offset that? We'd already moved most of our employees to ICHRA plans, which depend on subsidies from the ACA. Right? And so really thinking about what do employee benefits look like. And then lastly, doing a portfolio analysis about what works and doesn't work in our portfolio. And Althea, I think somebody from Mosaic will be reaching out to you because we have a lot of low income, affordable, accessible housing that we don't need anymore. And we've been trying to have someone help us figure out how can we give that to someone who needs it, right? But it's so complex to even figure out who to go to get our questions answered.
Please do reach out.
Yes, I sent our CFO a note while you were speaking. I love the connections LSA makes for us. It's great. The third thing we're doing is really giving voice to issues. And I keep going back to Martin Luther King Jr.'s quote about it's hard to hate up close, and telling individual stories about people we support, the fact that they have $60 a month personal spending money. People aren't living an extravagant lifestyle on Medicaid. They barely have enough to get by, the importance of charitable giving, and all those things that are so critical. People in the general public don't seem to know, but they want to know. So that's really hard, but we're trying to create these ambassadors, or I call them evangelists, but ambassadors who go out into the community and spread the word about the importance of Medicaid. And lastly, leaning on some work we did at the LSA CEO Academy last year, we've now engaged a consultant to do scenario planning with Mosaic and help us envision what are some plausible futures. And anymore, futures 3 years, 5 years, 10 years, but really trying to imagine what is possible for Mosaic while we remain firmly grounded in our why. And the last thing I guess I would say is that we've really been focusing on how do you lead during times like this. When we begin with our workforce to talk about all of the challenges we know exist, you could usually hear a pin drop in the room. People might be personally affected by immigration issues or by SNAP or all those kinds of things. And so really trying to be a beacon of hope that we've been through tough times before, our services are needed, we're valued, but we're keeping our periscopes up and we're looking up and out to pay attention to what's happening in the environment, but we're not giving up on our strategic plan. So that's just some examples of things we've been doing at Mosaic today. We'll see what we do next week, but that's what we're doing today. So thanks, Bill, for the opportunity.
Oh, Bill, you're on mute.
I was muted and I was thanking you for your presentation and your pragmatic way of approaching that. And the theme that I took through all 5 of those points was relationships. It takes time to build relationships, but we're doing this at such a needed speed. And so I really thank you for those ideas and ways that as organizations can start to approach that. And I'm sure that other people are sharing that as well. And I think that's the strength of our network, is being able in conversation about what's working with you, what are your priorities, and how are you going about this. So we have a poll out there for people, kind of how did the presentations go and what did you learn? So
Yeah, please, it's question 2 that reflects post-webinar knowledge. So thanks so much.
all right. Sarah, I'm going to go ahead and end the poll and share it. So it did seem like our understanding, our basic understanding increased. So that is good. We appreciate you guys staying with the presentations. I do want to end with just inviting you to our next capital conversation will be October 16th. And I also want to invite you to our community, which is our online learning platform with Unity at the end of that word. There are invitations that have been sent out with regular basis, looking for people to engage with that. Check your blocked or spammed emails just in case it's getting caught up in there, or email myself or Sarah or Kylie or Chris, and we'll make sure that you're signed up for that. And join our advocacy leads group. I want to remember people to save the calendar invite for these webinars as a recurring event. You will always have that link on your calendar, and you'll receive a follow-up email from our team containing all the materials that we covered today from the webinar and more information about upcoming webinars in the series. Thank you so much for joining us today, and have a great day.